Welcome everyone. I'm here today with Dr. Martin Ward-Platt, and we're talking a little bit about his two presentations that he's going to be presenting for us for Gold Perinatal this year. So the first presentation we're going to talk about is called New Directions in Blood Glucose Management. So Martin, what do you feel is the biggest myth when it comes to newborns and blood glucose management?
Well, if you'd asked me that question 5 years ago, I think I would have focused on the biggest myth being that an awful lot of babies need to have their blood glucose measured at all. I think I have a very different position on this now. I think that the biggest myth about blood glucose management is that blood glucose is necessarily all that important at all. And I think the biggest myth is really that we're focusing on glucose when we really need to consider lactate much more than we traditionally have. There's a lot of evidence now that if you have decent circulating concentrations of lactate, then the neonatal brain can manage very happily without very much glucose. And the whole notion that there is a quote-unquote safe level of blood glucose, or indeed that the neonatal brain is necessarily that dependent on blood glucose, I think is coming more and more into question. So I think the myth that I'm focusing on in my talk is very much about the perhaps secondary importance of glucose and the primary importance of thinking about fuels and fuel measurement. And I suppose when you add that on, then it's going forward, the big thing then is about lactate measurement.
Wonderful, thank you. It's certainly very interesting, and it's certainly very different from what we're used to hearing about when it comes to newborns and blood glucose. So what do you hope that healthcare providers are going to take away from your presentation?
Without doubt, the importance of lactate as a fuel. I think this has always been around, and I've spoken about it, and it's always had slightly second fiddle to presentations about glucose primarily, but I think the direction of recent work has very much indicated that the lactate concentrations tend to be considerably higher in those very babies that we've traditionally regarded as the most vulnerable. And therefore, these babies are perhaps much less vulnerable than we have previously thought. If we only measure glucose, we frighten ourselves and we do things to these babies, but actually if we measure glucose and lactate, we can come away with a much more sane and satisfactory view of these babies, and we can understand much better why some babies with very low blood sugars are perfectly healthy and perfectly well, and it's not because their brain somehow doesn't need glucose because it doesn't need glucose. Their brain doesn't need glucose because it's got lots of lactate, and it's all about thinking of fuels for the brain a little bit like a smorgasbord with things on it rather than some sort of single meal that we have to eat. And it's quite a big paradigm shift. I make no apology for talking about it as a paradigm shift, but it becomes possible to make this paradigm shift because an awful lot of units now have the ability to measure both glucose and lactate simultaneously because modern blood gas analyzers allow both of these measurements. So whether a baby is in a NICU or is on a postnatal ward with their mother, so long as you've got access to making both measurements, we can start to move away from the notion of glucose as the only thing that's important. And it will also move people away from relying on single measurements such as the near-patient monitors of various kinds. There's a number of brands of glucose meter, but should we just be measuring glucose at all? Well, I think not. I think we should be putting these single meters into the bin and thinking about making sure we measure glucose and lactate simultaneously. It's pretty radical stuff.
Wonderful. Thank you so much. I agree with you that I think that is a paradigm shift, and certainly very, very interesting, and I'm really looking forward to hearing your presentation. So for those of you listening, Dr. Martin Ward-Platt will be talking about new directions in blood glucose management on Monday, October 27th. So we hope to see you there. And Martin will also be talking to us about infant feeding and infant care in a South Asian immigrant community. That presentation will be on Tuesday, October 28th. So Martin, I'm very curious, what is it about the South Asian immigrant community that led you to want to take a closer look at their infant care practices?
Well, it's been known for a long time over here in the UK that if you look at some really important, hard outcome of infant care, like cot death, that there's a huge disparity between rates of cot death amongst background population and rates of cot death amongst what we broadly call the South Asian community. Now, we have big South Asian immigrant communities in the UK. They are not by any means homogeneous groups. We have people from India, and India is not exactly a homogeneous country either. We have people from India, we have people from Bangladesh, we have people from Pakistan. And although these peoples are often lumped together as some sort of homogeneous group, what they do share in common is a very much lower rate of sudden infant death syndrome than the background white British population. And this has long suggested to people that there might be things that we could learn from these communities about newborn care, and it has resulted in pieces of work that go back 20 years or so, where some interest was taken in this phenomenon in Cardiff in South Wales. So we were very interested because we'd done quite a lot of work on cot death, on infant care practices that might create risk, and we were very interested in looking at the strategies that people employ in their infant care that may have a number of trade-offs, so that people may employ quote-unquote risky practices, but they're doing it for a very good reason, and we have to understand those reasons if we are to make any progress in reducing the rates of cot death further amongst our population as a whole. The disparity is big. South Asian communities have a background risk of cot death that's something like a tenth that of the white British population. But at the same time, if you talk to your colleagues over here in our health visiting community, there's quite a lot of stereotyping of the behaviours of these communities, and the health visitors often try to get people from the South Asian communities to change, to do things differently, and therefore we've got a sort of cognitive dissonance. On the one hand, we've got a community that whatever they're doing seems to be much safer than what the white British population are doing, and yet on the other hand, we have a sort of professional ethos that's trying to say, oh no, don't do it that way, do it like us. And that makes no sense at all, because if doing it like us makes infants less safe, how can that be a good thing? So there's a real issue here, and it seemed to us, looking as my colleagues were doing very much from an anthropological point of view, and it seemed to me, who has been exceedingly well infected by the anthropology bug, that we should be trying to tease out what lies behind these different behaviours. And that really was the primary reason for doing it. In addition, the Braddix study, which covered much of the same ground and for the same reasons, was also interested in other factors that relate to South Asian communities, because the community in Bradford in particular has quite high rates of death in infancy, but it's not because of sudden infant death syndrome, it's because of congenital anomaly and inborn errors of metabolism. So there are a variety of different conditions largely affected by background culture that need unpicking in different ways and for different reasons. But the Braddix studies, as it turned out, shed a great deal of light on cultural differences that were really quite profound.
Wonderful. Thank you so much, Martin. That sounds really fascinating, and I am really looking forward to both of your presentations, as I'm sure all of our delegates are as well. So for those of you listening, please join Martin on Monday, October 27th and Tuesday, October 28th to learn more about these fascinating topics. Thank you very much, Martin.
Thank you.